Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the Acupuncturist. Well, today our topic is about trigger fingers. Well, recently I actually have few patients in the last 2 weeks that suffer from trigger finger. Well, for all over the years, right? I've seen a lot of trigger finger patient. So what trigger finger is actually, it could be your middle fingers or index fingers or ring fingers. I've seen more cases actually on ring finger and middle fingers. Those are the most fingers that suffer from trigger fingers. So what they do is you may get pain from trigger finger. You may not get pain at all. Okay, so but a lot of cases I see that is they do have pain. Right? Some don't have pain. It just can't. When you make a fist and you open all the fingers, and that one can't open, and you have to actually use your hand. It'll make a quicking sound, and it open. And some people, some of you, when you suffer from it, it can't open, and as soon as you get your hand the other side of finger and help it click and give you pain. Right? And some you don't actually get pain. You don't actually it doesn't actually click, but you get pain all the time. You can feel it and hear pain. Most of the time pain is in here. You don't get pain in here. You don't get pain in here. Now this is a very hard case, even for a lot of acupuncturists. Okay, I've seen my patient been to physiotherapy, chiropractor, osteopath, to the doctor, specialist. None of this seems to have an idea or a quick treatment or effective treatment for trigger fingers. Right? Even acupuncturists, to be honest, even acupuncturists. And over the last 14 years, I've seen a lot, and I felt a lot of time because I think acupuncture can help them. I do opposites needle, like needle in here with needle in here, and I felt I sometimes get good result for it, but most of the time no. Not until I figured out the point for it, and ever since I needle this point, and it works. It works very well. All my patients, they respond to it. So I'm very confident to tell you that trigger fingers is treatable, and as soon as I put needle in, very quick, within few minutes, you feel the difference. Now, if you've been following my Facebook, you see that I have 2 videos recently and post out, and that's my recent 2 patients, and they came in. They say I have trigger fingers, and I let them show me how well the trigger finger present and how well they can make it first and open it up. And both of them stuck in there. They couldn't open it up. And one of them actually better, and sometimes it can open up with the fingers. Right? That's because I've been showing her some acupressure point, which I'm going to show you today, and she's been doing it there, and it reduced a lot of pain. It actually improved the range of movement, improved the process of open up fingers from a fist. Right. So I'm going to show you that, and if you're an acupuncturist, on those points, you needle it. Okay, you needle it. Okay, the real technique. If you want to learn the real technique, how to get to a point, and actually how to needle it. Now, I'm going. If you're an acupuncturist, I'm going to create a webinar, right? And you can learn from the webinar. I'm going to show you how to do it exactly. For patient, if you're a patient, or if you're an acupuncturist, you can show your patient this is how to do it. simple, right? But I will tell you, acupuncture will work even faster and better. Is the best treatment for that, right? But acupuncture can work. It work for a long time. I mean, the process is slow. The process is slow. It's not as good as acupuncture. But if you're an acupuncturist, you need to learn the real technique. Otherwise, you don't know how it works and how to get to the point. Right? I can show you the point, but the real technique, you have, if you want to learn the real technique, you have to attend my webinar. Right? And in the next few weeks, I'm gonna announce when I'm going to do the webinar for everyone. My webinar is not just talking about schizophrenia. I'm going to treat a lot of things and how to use the pulse and things to diagnose, and according to the diagnosis, and to treat the patient, right? And for everything, okay, not just for trigger fingers, right? So now, if this fingers, that is your trigger fingers, and what you're going to do is form. Well, this is we call the fourth metatarsal bone. Right? And between the third and the fourth, over here, and at the back of your hand, on your palm, at the back of your palm, right? Which is the back of your hand, right? That's the back of your hand. So you go and get the most sensitive one. When you press it and you hit the point and give it rubbing. Rub for 10 times, and then just gentle rub it, and focus on the point for 10 times and gentle rub it. So do it 2 or 3 times daily. If you're patient, 2 or 3 times daily. If you hit another point on here, then you can do it in here as well. So if you have 2 points over here, along here, you do 2 points. If you have 3, you do 3 points. Right? At least once a day. Whenever you feel pain over here, you do it. It will immediately get rid of the pain, or immediately relieve your pain. That's one thing. And as you loosen up all this point, you'll find that your fingers are much easier to open from making a fist, okay? And not just in here, you need to do it in here from the fourth and the fifth metacarpal bone in between here. So again, get to the sensitive point and work on it, right? And press it for 10 times, right? 3 sets of 10. Then what happened after this? If you're an acupuncturist, put needle in there. And yes, I'm not going to show you how to put the needle in. I've got one video. You can have a look on it. If you can see my technique, then learn it straight away, okay? Otherwise, if you want to learn the real technique and how to needle it, the technique is the most important thing, okay? The technique, I show you the point already. If you're an acupuncturist, if you're good in the technique, you have to do some technique in that, not just putting needle in there. It doesn't work if just putting needle in it, okay? And you have to do the technique, and you have to get to we call 得气, right? We call 得气. You have to get 得气, and what kind of 得气 is the most important, okay? I'm not just saying, well, you have to create a sensation in there. It's not that kind of 得气, all right? So my way to 得气, make sure that it actually works, right? And the way that I talk about 得气, and I'll teach it in my webinar, right? And the real technique, if you learn this, you're gonna help a lot of trigger finger patients. And I guarantee it, 9 out of 10, they're gonna respond to this thing, right? I'm not going to say, well, it's gonna be 100% and you can treat everyone. No way, right? 9 out of 10 will respond to this. One responds to this technique, just keep going with that, then you're going to fix it. Right? If you suffer from trigger finger, we are in Hamilton, New Zealand, Dunsdale. We have 3 clinics, Cambridge, Raglan, and Hamilton. So call us on 07 846 7956, 07 846 7956, and we're happy to help you to recover from trigger fingers. Thank you very much. Stay awesome, and I love you all. See you. Bye-bye.